Hello everyone, and welcome back to Health Diagnosis Alert, your trusted source for understanding the health challenges facing our communities today. In this episode, we'll be talking about one of the most serious and persistent health problems in the United States, heart disease. It's often called the silent killer because it can develop slowly and without clear warning signs. Yet it remains the #1 cause of death in the country. Today we'll explore what heart disease really is, why it's so common, how it affects the body, and most importantly, what you can do to protect yourself and your loved ones. Every 33 seconds, someone in the United States dies from cardiovascular disease. That's more than 650,000 deaths every single year, and more than from all cancers combined. Even though we live in an age of advanced medicine and technology, heart disease continues to claim more lives than any other illness. The good news is that most cases are preventable. Understanding the risk factors and taking action early can save countless lives. So what exactly is heart disease? The term heart disease actually covers a group of related conditions that affect the heart and blood vessels. The most common form is coronary artery disease. This happens when the arteries that supply blood to the heart muscle become narrowed or blocked by a buildup of plaque, a sticky mixture of fat, cholesterol, and other substances. Over time, this buildup limits the flow of oxygen-rich blood to the heart, leading to chest pain or, in severe cases, a heart attack. Other types of heart disease include heart failure, arrhythmias, congenital heart defects, and problems affecting the heart's valves or muscles. Heart disease develops gradually. It often begins with damage to the inner lining of the arteries, caused by things like high blood pressure, smoking, or too much sugar in the blood. Once that damage starts, cholesterol and other materials stick to the artery walls, forming plaque. As the plaque grows, it narrows the arteries, reducing blood flow. Eventually, a piece of plaque can rupture, triggering a blood clot. If that clot blocks blood flow to the heart, the result is a heart attack. If it blocks blood flow to the brain, it can cause a stroke. Now let's talk about symptoms. One of the most dangerous things about heart disease is that many people don't notice symptoms until it's too late. Some may feel fatigue, mild chest discomfort, or shortness of breath during activity, and assume it's just stress or aging. Classic signs of a heart attack include pressure or pain in the chest, pain spreading to the shoulder, arm, neck, or jaw, shortness of breath, nausea, or sudden dizziness. Women, in particular, may have subtler symptoms like unusual tiredness, lightheadedness, or discomfort in the back or stomach. Recognizing these early warning signs and seeking medical help immediately can be the difference between life and death. Heart disease doesn't appear out of nowhere. It's the result of a combination of risk factors, many of which are linked to lifestyle. High blood pressure, high cholesterol, smoking, obesity, lack of exercise, diabetes, and an unhealthy diet are the main culprits. Stress and poor sleep also play major roles. Some risk factors, like age and family history, can't be changed, but the majority of them can be managed through awareness and healthy habits. Let's break down the most common risk factors. High blood pressure, also known as hypertension, is sometimes called the silent killer because it has no obvious symptoms. Over time, it damages the walls of your arteries, making them more likely to develop plaque. High cholesterol is another major factor. Cholesterol itself isn't bad, in fact, your body needs it to build cells. But when there's too much of the wrong kind, called LDL cholesterol, it builds up in your arteries. Smoking is particularly harmful because it reduces oxygen in your blood and damages the lining of the arteries. Obesity and physical inactivity are growing problems in the United States. According to the CDC, more than 42% of American adults are obese. Carrying excess weight strains the heart, raises blood pressure, and increases the risk of diabetes, another condition closely tied to heart disease. Type 2 diabetes damages blood vessels and makes plaque buildup more likely. Even mental health can affect the heart. Chronic stress, depression, and anxiety can raise blood pressure and lead to unhealthy coping habits like overeating, smoking, or excessive drinking. So who is most at risk? Statistically, men tend to develop heart disease earlier, but women catch up quickly after menopause. African Americans are more likely to suffer from high blood pressure and related complications. Age also plays a big role. A risk increases sharply after 45 for men and after 55 for women. However, heart disease is no longer just an older person's problem. More and more young adults are being diagnosed because of poor diet, lack of exercise, and rising obesity rates. Let's move on to how heart disease is diagnosed. Doctors have many tools to detect problems early. A routine checkup may include measuring blood pressure, cholesterol, and blood sugar levels. If there are concerns, your doctor may recommend an electrocardiogram, which checks your heart's electrical activity, or an echocardiogram, which uses sound waves to create images of your heart. A stress test shows how your heart performs during physical activity. In some cases, imaging tests like cord scans or angiograms are used to look for blockages in the arteries. Early detection through these tests can make treatment more effective and prevent heart attacks before they happen. When it comes to treatment, the approach depends on the type and severity of the disease. For many people, the first step is lifestyle change: eating healthier, being more active, quitting smoking, and managing stress. Doctors may also prescribe medications to control blood pressure, lower cholesterol, prevent blood clots, or regulate heart rhythm. In more serious cases, procedures like angioplasty or bypass surgery are needed to restore blood flow to the heart. But the best treatment is prevention. So let's talk about what you can do right now to lower your risk. Start with your diet. Focus on eating plenty of fruits, vegetables, whole grains, lean proteins, and healthy fats from sources like nuts and olive oil. Cut back on processed foods, sugary drinks, and high-sodium snacks. Remember, every small change counts. Replacing just one sugary beverage a day with water or herbal tea can make a big difference over time. Next, get moving. Aim for at least 150 minutes of moderate exercise per week. That's about 30 minutes a day, 5 days a week. You don't have to run marathons. Even brisk walking, cycling, swimming, or dancing can strengthen your heart. If you sit for long periods at work, take short breaks to stretch or walk around. Every bit of movement helps. Avoid smoking, and if you already smoke, seek help to quit. Within 1 year of quitting, your risk of heart disease drops significantly. Limit alcohol intake to moderate levels: 1 drink per day for women and 2 for men. Get enough sleep, ideally 7 to 9 hours each night, because poor sleep can raise blood pressure and increase stress hormones. Speaking of stress, managing it is crucial. Chronic stress triggers inflammation and unhealthy habits. Try relaxation techniques like deep breathing, meditation, yoga, or simply spending time outdoors. Surround yourself with supportive people, friends, family, or community groups. Social connection is good for both emotional and heart health. Let's also talk about the importance of regular checkups. Many people feel fine and skip their annual doctor visits, but that's when silent problems can develop. Routine screenings for blood pressure, cholesterol, and glucose can catch early warning signs before they turn into something serious. If your doctor prescribes medication, take it exactly as directed, even if you feel well. Stopping medication suddenly can raise your risk of heart attack or stroke. Technology is also playing a growing role in heart health. Wearable devices like smartwatches can now track heart rate, detect irregular rhythms, and even alert users to possible atrial fibrillation. Remote monitoring allows doctors to follow patients' heart activity in real time. These innovations are helping people stay informed and take control of their health like never before. Let's not forget about the social and environmental factors that affect heart disease. Access to healthy food, safe places to exercise, and affordable healthcare all influence heart health. Communities with more green spaces and lower pollution levels tend to have lower rates of cardiovascular disease. That's why public health initiatives like improving nutrition programs, promoting active lifestyles, and expanding access to preventive care are so important. Despite all the challenges, there's hope. Over the past few decades, death rates from heart disease have fallen thanks to better awareness, medical advances, and lifestyle changes. More people are getting screened, more are quitting smoking, and more understand how important diet and exercise are. But the battle isn't over. Obesity and diabetes rates continue to rise, and many Americans still underestimate their personal risk. That's why education and awareness like what we're doing here today are vital. Now let's take a moment to talk about the emotional side of heart disease. Surviving a heart attack or living with a chronic condition can be life-changing. Many patients experience anxiety, depression, or fear of recurrence. Emotional recovery is just as important as physical recovery. Support groups, counseling, and cardiac rehabilitation programs can help patients regain confidence and rebuild healthy routines. Cardiac rehabilitation is a powerful tool for recovery. It's a structured program that includes exercise, education, and emotional support under medical supervision. Studies show that patients who complete cardiac rehab are less likely to have another heart attack and live longer, healthier lives. If you or someone you know has had a heart event, talk to your doctor about joining a rehab program. Let's also discuss the role of family. Heart disease often runs in families, not only because of genetics but also because of shared habits. If someone in your family has heart disease, take that as motivation to make heart-healthy choices early. Encourage family meals with healthy foods, weekend walks, and shared fitness activities. Small steps taken together can have a big impact over time. Now let's address some common myths. Some people think that heart disease only affects men. That's false. It's actually the leading cause of death for women as well. Another myth is that you'll always have warning signs before a heart attack. In reality, many attacks occur suddenly with little or no prior symptoms. Others believe that if they're thin or active, they can't get heart disease. While fitness helps, factors like genetics, stress, and diet still matter. We've covered a lot today, but let's recap the key takeaways. Heart disease remains the #1 killer in the United States. It's caused by a mix of lifestyle choices, genetics, and environmental factors. Most cases are preventable with healthy eating, regular exercise, stress management, and routine checkups. Recognize warning signs early. Chest discomfort, shortness of breath, fatigue, and unexplained pain should never be ignored. To protect your heart, focus on 4 simple goals: move more, eat better, quit harmful habits, and get regular checkups. Small daily actions like walking after meals, swapping fried foods for grilled options, or managing stress add up over time. Remember, prevention starts with awareness, and awareness begins with conversations like this one. So as we close today's episode, I encourage you to take your heart health seriously. Talk to your doctor, encourage your family to make healthy choices, and be mindful of how your daily habits shape your long-term well-being. Heart disease is powerful, but knowledge, action, and community support are even more powerful. Thank you for watching Health Diagnosis Alert. If you found this episode helpful, don't forget to like, share, and subscribe.